one of the main likelihoods of mortality from what we were calling corona deaths was not coronavirus at all. It was actually comorbidities of cardiovascular disease, diabetes, and kidney disease, which none of those three have anything to do with the physiology of the virus per se. And so it was begging the question of, well, why are those three populations the ones? Why isn't it the patients that have chronic asthma, emphysema, and all of that are the top ones there? Why isn't it the lung patients that are so at risk for this respiratory virus, as it's been called? And as it turns out, those three categories of patients have to be put on the same two drugs. And so, as I was saying earlier, the machine is trying to find simpler and simpler algorithms so that the complexity of a day of a physician can be executed quickly. So you need a doctor to come in and see do pattern recognition and then immediately say, these are the two drugs you need. And in the very extraordinarily complex disease pathophysiologies of cardiovascular, cerebrovascular disease, diabetes in the liver, and kidney disease, all three of those have now been boiled down to a clinical algorithm that you just have to put them on a statin drug and an ACE inhibitor blood pressure medicine, and you've won the game as a physician. You can check those two boxes and say, I just practiced the standard of care for any of those. Now you're talking about nearly 1 billion patients worldwide with one of those three conditions. And so we've boiled those three conditions globally down to two medications, and those two medications pertinently change the terrain of our lungs to overexpress the receptor for coronavirus. And so we have changed the terrain, we have changed the physiology of humanity through this narrow, blinders on perspective, this reductionist, belief system that pharmacy is going to fix everything. And in so doing, we made the whole population prone to a disease, event that actually had very little to do with the virus at the beginning. And it had to do with a change in the terrain, just as the weed is not the thing that comes and attacks the farm. The farm is failing, the soil is failing, and therefore the weed shows up. Corona is a natural part of our micro ecosystem's communication network, okay? So microbiome, bacteria, fungi, all of these are communicating. Corona is there as a communication network. As if it starts to develop an abnormal relationship with our terrain, it's because we've modified ourselves. And nowhere is that more obvious in this pandemic than those two drugs of the statins and the ACE inhibitors.